My name is Shantiana Johnson, and I am the RN. And thank you for taking the time out to this interview with me.
Absolutely.
So, can you tell me about yourself?
Sure. My name is Satora Johnson. I'm a certified nurse practitioner for general surgery. That's the specialty that I work in. I'm a wife, a mother of 3 children. I began nursing specifically because I was passionate about helping people and providing care for people. And so that's what kind of started my journey as a nurse. I did work in med-surg for about 3.5 to 4 years prior to going to NP school. And I worked in med-surg, and I kind of leaned more into the surgical aspect. So I knew I was a bit more passionate about surgical patients. And so that kind of prompted me to go back to school to become a nurse practitioner. And I have currently been practicing as a nurse practitioner for the last 3 years. My first year was like outpatient urgent care, and a job position opened up as a nurse practitioner for general surgery, which was the area that I was most passionate about. So I was excited to do that. And I've been in this role for 1.5 years.
Good. I'm glad to hear that. So, can you describe your APRN position, including specialty?
Yes. So I'm a nurse practitioner for general surgery. That means I collaborate and work with 4 surgeons, as well as 2 residents, anesthesia, and regular RNs as well. And in my role, I round on patients post-op. I also provide admissions for patients from the emergency room, and proceed with ordering, diagnostic tests, labs, and education is a huge part of my role as well, when it comes to educating patients on surgeries, procedures, post-op restrictions, and various things like that.
Okay. So do you see an APR influence in today's healthcare system? If so, how? Like, do you see it as a big influence?
I see several influences, but they're not ideal for me. And what I mean by that is, I work in a hospital, so I'll see a nurse practitioner working in infectious disease, a nurse practitioner working in internal medicine. But there are no other nurse practitioners for general surgery. We take care of 3 different hospitals, and I am the only nurse practitioner for general surgery. So yes and no. Mm-hmm. I see other nurse practitioners practicing and in various specialties, but not specific to general surgery.
That's tough.
Yeah.
That's why you can't never turn your page around.
That's true. Very true.
Okay, so what are some barriers that APRNs face?
Specific to myself, I don't exist anywhere else. So it's a good and a bad. One, there is no blueprint for what I'm supposed to do, what my responsibilities are, what are the expectations of my job. So that can be a good thing and a bad thing. And the reason I say that is I work with 4 different surgeons with 4 different personalities, 4 different expectations. And so there's a wide range of what's expected of me. And so it's a little challenging because there's no specific criteria that I'm going by. We're trying to establish what that criteria looks like. So in a way, to trailblaze is nice, but it's challenging as well, because along with the 4 surgeons that I work for and their different personalities, I also work with 2 residents on a day-to-day basis. So expectations differ from surgeon to surgeon. I manage the residents as well, so their personalities can differ and expectations for them can differ. And so the ambiguity is challenging, and then having a specific standard to go by is challenging, but it's a feat that I'm passionate about. So I kind of take the good with the bad in regards to that. And I'm happy to establish and make it easier for other nurse practitioners when they come into the role or into other various roles. So you have that on one end, that's great. And then you have the complexity of what your expectations are. Some want you to do a lot of things. Some just kind of want you to manage their orders and their patients. So it fluctuates from day to day. So that can be a challenge and a benefit to a degree.
Okay. So would you say that it benefits you more that there isn't no blueprint and that it's...
I think it's 50-50.
Okay.
It's bittersweet because I'm establishing what that looks like. But prior to establishing what that looks like, you kind of find yourself doing a bit of everything to see what's a good fit. So you can come home stressed, overwhelmed certain days because you don't fully know what it looks like and what it needs to be. So the grunt work is, I'm still in the process of doing, so that makes it challenging, but the end result will be beneficial.
Okay. And also it probably sorry, these are my own little things I'm thinking about, but with that being, there's no blueprint, you also probably have to come home and look at different things for yourself when it comes to making sure if you're okay with, if that is within your scope.
Absolutely.
And if it goes, thinking about your license and everything
right.
like that. So.
Absolutely. Understanding that Ohio is a restricted, so with us being restricted, you don't have full capabilities of doing everything. I'm cautious and careful about having surgeons co-sign on certain things, but it's my responsibility to know and to understand what is in my scope of practice and what is beyond my scope of practice. So.
Okay. What changes would you like to see made for APRNs?
Definitely standardized care, the expectations. It is easier to go by a blueprint and know what is expected of you, know and understand what's in your scope of practice. And it varies state by state. So that can become challenging. If you're trying to move to a different state and operate somewhere else, the standard of care is completely different than what it is in Ohio. And with that being restricted, it's a catch-22. We, as nurse practitioners, get paid 80% of what a regular provider will get paid for, say, care plans, diagnostic tests, different things like that. So the reimbursement is different. And what that causes is a ripple effect where they don't look and value nurse practitioners as much, and it kind of undercuts us in a way, although we can practice and do certain things that other providers can do. We just don't get the full reimbursement for that. So that's definitely something I would like to see a change in, and an understanding of what a nurse practitioner can do and where their limitations are. If that is clear all across the board, it's better for everyone involved.
Okay. Would you, do you feel like the respect level that you have it at the level that you would like it to be at the facility you work at, and with the physicians and residents?
With the surgeons and residents, it is. With other providers and other specialties, not quite. Sometimes they look at you as, oh, you're a nurse. And understanding that I'm an APRN, which is an advanced practice nurse. So my expectations are different and my qualifications are different. I do not look at it as an undercut being called a nurse. I'm very proud of that,
right.
But it's almost as if, well, you're the assistant for some people. But I cannot say that about the surgeons that I work with. They're very good, as well as the residents that I partner with.
Okay. Well, thank you for taking the time out to interview with me.
Absolutely.
On your busy schedule. I appreciate
Thank you.